Hey, good evening, everyone. It's Carlos, aka CJ. I hope everyone had a fantastic day. Today is Wednesday, February the 24th, and very excited to be here for a very special webinar session with healer. Many of you are already very familiar with Dr. Dustin Sulak, who by far is one of the most formative individuals as it relates to cannabis and health, as it relates to nutrition. And then also, he has 2 clinics and then his healer program. And tonight, before we kick things off, I'm very excited to be joined by Alyssa Mills. And Alyssa is one of the representatives with Clouds by Design. And Alyssa is also going to be doing some live stream. We're excited to relaunch the podcast on Rogue 420. That many of you are familiar with, and she will be joining as a co-host for that show. So, Alyssa, welcome to Rogue 420.
Hello, everyone. I'd like to start off by saying thank you for giving me this opportunity to help share a more natural way of living. Not only am I an advocate for CBD and Delta-8 THC, my mission in life is to help be a voice for people that have invisible illnesses that can be a total burden on your day-to-day life. I aim to treat it in the best possible way. Nature can be your best guide to pretty much healing yourself from within the inside of your soul. So I'm here to help share the wisdom of our nature and who we are and how we can be better. So thank you for giving me this opportunity to speak on behalf of Clouds by Design.
Alyssa, absolutely. And, if you would like, and again, several of the Rogue listeners have supported our work, not only with my CBD edibles, but also with Clouds by Design. If you would like, if you want to take a minute and also share your email address and then also your business phone number in case any of the listeners would like to contact you in regards to the Delta-8 products by Clouds by Design.
Absolutely. If you want to get into contact with me, you can either follow me on Instagram. It's just Alyssa Mills 77, or you can email me at Alyssa Mills cloudsbydesign@gmail.com. And my phone number is, sorry, one moment.
No, it's okay. Yeah.
My phone number is...
Don't forget, make it your business one.
It's my business one. It's not my personal. That's why I had to make sure. It's 765-507-3424. So if you need any wholesale or just want to try out the product or even just have any questions about the product, I would be an ear and answering any questions that you may have.
Yeah, Alyssa, also, you've been doing some blogging on the sites, and I actually picked one of those up over on Rogue 420, and it was vaping for beginners. So kudos to you for writing that. I know there's from a few years ago with some bad actors who were producing some vape products with some vitamin E, I can't remember if it's acetate, what the proper word is, but unfortunately, it kind of gave the vaping industry kind of a black eye, if you will. And yeah, and so again, that article you can find over at rogue420.net. And it just kind of breaks down in regards to, vaping for beginners, the therapeutic side of why it's important in terms of the bioavailability of vaping versus an edible and, different way of getting the cannabinoids into your body. And tonight, and hopefully, the lineup for tonight with Dr. Dustin Sulak is a great. He has another doctor that's going to be joining him, and they're going to be talking everything from cannabis and CBD for pets, to treating of autism, as well as the effects of CBD on blood pressure, that a lot of people are unfamiliar with that territory. So instead of getting it from myself, who is not a doctor or an expert, we'll have Dr. Dustin Sulak here to break that down for us, which should be a lot of fun. So I'm excited for this Zoom session, this webinar with Healer, and the work that Dr. Dustin Sulak does with his program of Healer has just been so important for patients as well as our industry to, really bring the professionalism, if you will, and tie it directly to health outcomes and really make a difference for the people who are using cannabidiol, CBD, full spectrum, cannabis to help with their medicinal needs. It's just that important. So, and I'm confident, Alyssa, once we get this schedule lined up for our podcast, it'll be a lot of fun to sit here. And I know that we've connected on different types of content, whether it's, Joe Rogan podcast where there's like a 2-minute blurb that we capture and we listen to. It's like, oh my God, this is just amazing. We should discuss this. And so I'm looking forward to kicking off the Rogue 420 podcast with you. It should be a lot of fun.
Absolutely. And like I said in the beginning, I'm very thankful and appreciative of this opportunity to be able to grow the hemp industry and share a more natural side of things that we haven't been able to come in this day and age. We are stuck in the processed food, the opioid pandemic, all the terrible things that we've put into our body. And now there's a natural way that we can cope with things. And I hope to only broaden people's horizon on it.
Very well said. And they're getting ready to kick off the Zoom session, the webinar, which we're very excited for. I need to make sure that I did properly share the audio to that stream. So I need to click on that real quick and then bring it in. So there we go. Okay. Well, Alyssa, thank you so much for joining and introducing yourselves to the Rogue 420 listeners. And we'll be catching you real soon.
Thank you for having me.
All right. Take care, Alyssa.
Dr. Brzezinski. We still need to catch lunch on campus sometime. Let's do it.
All right, well, it's 7 o'clock. Let's get started. So welcome everyone who's here. I see a lot of familiar faces and some new ones. And I always appreciate when people turn on their camera and interact. It makes it feel live and we get that energy feedback, which is so nice. My name's Dustin Sulak. I'm an osteopathic physician and co-founder of Healer.com and all the things that we're doing at Healer. And for those of you that are new, tonight's webinar is something that emerged from the Healer Training Certification Program, which is an online curriculum that we have for people in the medical cannabis field, whether dispensary agents or clinicians or caregivers to family and friends or self or anything in between. It's an online curriculum that includes these monthly webinars where I go over some research that's come out in the last month or two that I think is clinically relevant. And then we do a lot of question and answer and cases and basically just learn from each other as a community. And so we decided to make these webinars free for everyone during the COVID shutdown, and that's been popular. And I'm just very happy to continue that. People that are a part of the training community, which is a paid program, have access to the webinar recordings, and they're all kind of outlined in terms of what we're talking about when, so they're time stamped and you can quickly jump to a question or answer that you're interested in. And I really encourage participation. So it's really nice to see you all and to dig in. And tonight we have a special guest and a special topic because my expertise is human medicine, not veterinary medicine, but we have a lot of people with pets who love their pets that have been asking questions about how to work with pets. And so I thought I would bring on someone that has more experience than me, and that's Stephen. And so I'm gonna let Stephen introduce himself and do a little interview with him before we jump into the research topics. Now I just have a very few, or just one real announcement tonight, which is that we're offering 20% off on the Healer Hemp line of products. That's the CBD and the CBDA, and the promo code is webinar. If you guys haven't tried our products yet and you like CBD or hemp products, I highly encourage you to. I think if you look at the reviews on the Healer website, you'll see that people really notice a difference with our high quality products. So that's, and that's it for announcements. Why don't we jump in to our content, and we'll start with Stephen. So yeah, please, Stephen, go ahead and tell us a little bit about your background. I think most people that are here probably saw the email and understand kind of your credentials, but if you could go over them briefly. And then what I'm most curious about is like the path that led you into the role where you find yourself now as a cannabis veterinary expert. So tell us about that.
Sure. So thanks for having me. I'm super excited, super bummed we're not live at one of the cannabis science conferences. I think that's where I first met you in person and got to see you speak. And I think you got to hear me speak. So that was awesome. I am a registered veterinary technician out of California. If you're not familiar with that, that is similar to an RN, except on the veterinary side of things. And on top of that, I've really kind of built my specialty and have taken extra certifications for anesthesia and pain management specifically. So I'm also a certified veterinary pain practitioner, and I'm also a veterinary technician specialist in research anesthesia, and have a couple of other credentials, but they're all anesthesia pain management related. And that's really how I got started in this. I am living in the Bay Area, grew up in California, and obviously the Bay Area has a little less stigma when it comes to cannabis use in general compared to other parts of the country, and had a lot of clients coming in asking about these types of products, in particular for animals that had cancer, in particular for animals that were in some sort of palliative care situation, asking about these products. And at the time, I didn't know much about it other than my own recreational and medicinal use of cannabis, but figured, you know what, if these animals are in a palliative care or terminal kind of situation, I don't see where they couldn't benefit from some of the positive effects that we see from this type of therapeutic. And didn't understand a lot about it, was stuck in the myth, similar to what I believe is going on in human medicine of we just don't have enough evidence, or we don't have any evidence whatsoever. That is very strong in veterinary medicine. And when I started actually using institutional access through the university to look up some of these papers, I found, oh, wow, there's a whole plethora of research out there in several different species, it's up to 27 different species of animals so far in the laboratory animal setting, which is easily translatable to clinical practice because we see those species in clinical practice. And from there, it's just kind of snowballed and got deep into the research, then started helping with my own research and doing my own research, speaking on the topic, and have a book coming out now, which is very exciting, just because most veterinary practitioners, whether you're on the technician or the veterinarian side, the doctor side, we just don't learn about the endocannabinoid system. We don't learn about cannabinoid pharmacology. We don't learn about any of this other than THC is toxic and to stay away from it. So really trying to get out there. I speak at maybe 20 to 30 veterinary conferences a year to huge rooms full of people because they're all so excited about this. And there's so many questions coming from pet owners about this topic. So re-educating the veterinary community on this topic as well.
Great, thank you. All right, well, let's just kind of start with broad strokes because we know that cannabis has a lot of nuances here, and I don't expect you to, hit all of those with these broad strokes, but just in general, if we're thinking about either THC or CBD, are there any major differences between what we would expect to see as an effective THC or CBD in a human versus a pet?
Yeah, well, I'm talking about nuances in veterinary medicine. Yes. So when it comes to THC, that is obviously the most contentious molecule when we start talking about it as far as medicine. And some of that stems from what we see in practice, especially after legalization started occurring in the country. One of the first studies that came out after legalization was out of Colorado, where a study was published with 125 dogs that had THC toxicity. And 2 of the animals in that particular study actually were euthanized. So that did not do anything to help as far as looking at these types of molecules in a medicinal way. So by and large, most practitioners are pretty scared of THC in general. So in the veterinary world, there tends to be a lot of leaning on hemp products, so CBD dominant products, usually something, a 1:4 or a 1:20 ratio, something greater with CBD compared to the THC in there. However, THC can be used safely and effectively in animals. The dosing is just a lot more detailed, and we have to be a little bit more cautious. I think you're one of the people that also suggests kind of starting low and go slow and work your way up. Find that sweet spot for whatever ailment you're trying to mitigate. We do the same thing in veterinary medicine. When it comes to CBD, we're finding all kinds of interesting things in some of these studies as far as dosing. And as far as relative safety, lots of safety, just like we have in human medicine, which is really great.
And the kind of indications that we might use THC or CBD in pets, is it similar to what we might consider in people, which of course is kind of like everything under the sun, but are there any differences when you would see a pet with, a certain presentation of a symptom? Anything surprising there that we might like think about THC or CBD in a different way than people?
Yeah, so in general, the uses of these types of molecules seem to mirror exactly what people want to use them for. I would be a little bit more cautious with using THC dominant products for things like anxiety in animals. I think people, we have this understanding that we are taking THC, we can be knowledgeable, we can have a conversation with a pharmacist or your physician about THC and some of its effects. We know that THC can, in some people, create a little bit of anxiety. We can't necessarily explain that to an animal. So the animal may freak out or even get a little bit more stressed out. So we do have to be a little bit more cautious there. But by and large, not a lot of other differences when it comes to these types of products and animals.
Okay, great. And so I just want to emphasize, I think for years I had my patients come in and kind of, it was similar to this idea that chocolate is bad for dogs, but everyone just had this like basic, idea that THC and dogs don't mix. And I heard that myth, that rumor so many times. And like you, I said, well, it seems to do well in most mammals and we all have this endocannabinoid system. And I can't imagine why one species would be so different than the others. And so I just, really want to, emphasize that, yes, even dogs can benefit from THC. You agree?
I definitely agree. And I think what's important, I mentioned that study after legalization became a thing in Colorado with 125 dogs. The 2 animals that did die in that study also had co-intoxication. So one of the dogs, unfortunately, got a sheet of brownies. So not only did it have THC in there, which was creating its own side effects at large amounts, and we can get into 11-hydroxy-THC and all that fun stuff, but we also had chocolate in there. So it was a co-toxicity. And when I talk to my criticalist and my toxicologist friends, we believe that if finances weren't a limiting factor, that these animals could have easily pulled through this toxicity of both the theobromine and the THC. One of the other animals that was euthanized in that particular study had the THC, but also raisins, which can be toxic to dogs as well. So even in veterinary medicine, we don't have good published data showing that THC is the culprit as far as killing or severely injuring an animal. Yes, they can become intoxicated. Yes, it's a lot of nursing care and some inconvenience, but by and large, these animals can recover fairly well.
Got it. Great. Okay, now amongst pets, do we see any major differences, like say between cats and dogs or cats and horses? Any kind of clinical pearls there? Like, oh, in cats, I always do this, but I never do that. Or again, are things pretty similar?
So what's interesting about animals is every animal has its own metabolic rate, its different metabolic pathway, and we do see differences. Cats, oddly enough, seem to do much better with THC compared to dogs. And I think that's because when we look at receptor density, the CB1, CB2 specific receptor for dogs versus cats, we see a lot more of those CB1 receptors in the brain in higher densities compared to maybe cats. Cats also don't tend to get what we call static ataxia with THC, even at higher levels compared to our dog friends. Static ataxia is where the dog's kind of wobbly, maybe they're kind of shaky, maybe they're kind of dribbling some urine as well. They can be hyperesthetic, oh my gosh, what's that noise? What's that bright light or whatever? Cats don't typically do that. And this is just anecdotal. I don't think there would be a paper on this, but cats seem to almost ask for some of these products sometimes, especially when they become acclimated and seem to benefit from these products. I have cat owners all the time saying, my cat seems to be asking me for this type of medicine pretty regularly compared to dogs, especially if it's a full spectrum. They're like, what is this smell? Get this away from me. I don't want to take this anymore.
Got it. Thanks. That's a great answer. Okay. Before we, and I know a lot of our listeners want some orientation to specific dosing, but before we go there, anything else stand out to you as like a major caution, for pet owners that might be treating their pets with THC or CBD? Pets obviously don't talk the same way that we do and may not be as able to, report adverse effects, but what stands out in your mind as like the top cautions for pet owners?
My biggest concern right now is honestly not these molecules. Obviously, we need to be concerned about dosing and what we're using these types of products for. However, my biggest concern at this point, just because this is an unregulated field, hemp products, which is the dominant thing that is being used in veterinary medicine, is not regulated well, is poor quality products with some contaminants in it. I did a study with some colleagues that was published in 2020, where we pulled 30 hemp products off the shelf, tested them, and we did find that some products had high levels of lead and arsenic in there. One of the products had so much lead in it, it would be considered unsafe to consume per USP guidelines. We found products just like we see in human medicine that didn't have any CBD in it whatsoever. And ironically, the products that didn't have any CBD in it whatsoever tended to be the more expensive products. So that was really unfortunate. So I'm most concerned about the quality of these products and honestly, the misinformation out there as far as education and the safety and utility of these things coming from people that maybe aren't necessarily qualified, even if they are well-intended, or if they're not well-intended and still spewing some of this negative bias towards this therapeutic potential.
Thank you. It's a good one for everyone to keep in mind. It's, if you find a product that you can trust, that's important, and that's kind of rare. There's just so much out there. All right, let's do a little orientation to dosing, and I certainly don't expect your response to kind of be a cookie cutter approach for everyone's pet. And I think people that know my work and that are part of the healer training community know that this is all about individualized treatment and, not just here's a symptom, here's a species, here's a body weight, what's the, equation and what do we treat with? So of course, people that are wanting to treat your pets with cannabis, we're trying to give you some background and baseline information, but it's always nice to work with an expert or at least someone that has more experience if this is your first time. But in general, with CBD, my kind of guess would be we might start in like the 0.5 milligram per kilogram of body weight dosing range. Is that on target or too low or too high? What do you think?
Did you say that for THC or CBD? Sorry.
CBD. For CBD.
For CBD, absolutely. If it's a CBD dominant product, I typically start at a 0.5 milligram, 0.5 milligram per kilogram dose, and start low and go slow. The endocannabinoid system is very complex, and depending on the tonicity of the ECS, we might have patients where we're stopping right there versus other patients where we may go up a lot higher.
And if you're seeing some, if there's a lead, right, you get a little bit of a benefit at a low dose, you start titrating, the benefit gets more and more over time. How high would you go? Do you push it all the way until you might see an adverse effect? And what should we be thinking about as far as like, and by adverse, I mean, a communication from your pet's system that, hey, don't go any higher on CBD. So is there a cutoff? Like, is it 10 or 20 milligrams per kilogram? And what do you tend to see as a communication that we don't want to go any higher on CBD?
Absolutely. So 10 and 20 is a dose that was used in a study out of Colorado State University with Dr. McGrath's lab. And that was generally just kind of a PK study, kind of a safety study as well. typically we don't have to go to doses that high. It does happen in rare occasions, especially with neurologic disease. But most of the time, we can get away with dosages between 0.5 and 2 milligrams per kilogram twice a day, even sometimes 3 times a day. It looks like cats might need some higher dosing. So for our cat friends, I might lean on that 3 times a day, maybe push them to like 3 mg per kg or higher. And as far as their signal, as far as backing off or maybe increasing more, the number one adverse effect or form of communication we might see from animals is certainly lethargy. And typically lethargy is typically transient or short-lived in animals. After a few days, their body figures it out and they're like, oh, okay, I can metabolize this stuff. I don't need to worry about it anymore. Or if they're on other medications, like it's not uncommon to see lethargy if the animal is on phenobarbital, which is often used for seizure disorders. If the animal is on a drug called gabapentin or Neurontin, they use that a lot for pain, even anxiety in animals. Or if your animal is on some sort of anti-anxiety drug like trazodone, it is not uncommon to see lethargy. If that lethargy is lasting for more than 3 days, I might back down on that dose a little bit, just because I don't want them to be kind of sleepy all the time. I don't think that's really fair for their quality of life. If it still seems to be effective, I'll leave it there. But if it looks like they were benefiting, if they were walking better, even though they were a little bit sleepy at that higher dose, I will maybe more slowly and more gradually increase that dose to where they can tolerate that particular dose.
Perfect answer. Thank you. Okay, so let's turn to THC. What's a conservative starting point? Are we talking 0.1 or 0.05 milligrams per kilogram?
Do you have my notes? Because that's exactly the dose I would.
No, I don't have your notes, but I mean, we both know this. So.
It's true. It's nice to be in like-minded companies. So yeah, for THC, when we start introducing THC, this is where I really kind of want to get on my ethical veterinary soapbox of, if we're going to be introducing THC and CBD for that matter, I think it's really important to at least let your veterinarian know that this is a product that you're going to be starting with this particular patient. But yes, 0.1 mg per kg twice a day, if not more, like 3 times a day, similar to CBD, seems to be a relatively fine starting point for most animals, and certainly can be increased. There are multiple studies where they were giving 25 milligrams per kilogram or higher to dogs in particular, and none of the animals in those studies had any severe negative side effects other than being stoned for a number of weeks in one particular study. But as you know, with THC, we can build a tolerance, and that is something that can occur in animals as well.
Mm-hmm. Yep. And if one has the option of starting with a combination of THC and CBD, is that, kind of shotgun approach a decent thing? Or is it, do you feel like a pet might, react to one so differently than the other that you might get better information from starting with one or the other rather than a combination?
I generally, just because of the laws in veterinary medicine and what's available to most pet owners here in California, dispensaries are technically not supposed to be selling hemp products. So there's only, cannabis products which have higher concentrations of THC, which can be a little bit more tricky to dose. So generally, I do start with like a CBD dominant product or a hemp product first. If that animal does have a more severe progression of a disease process, in particular cancer, severe forms of epilepsy where traditional anti-epileptic drugs are not working as well, or animals that are kind of on the terminal end of their life, on the end stages of their life, I would reach for a higher concentration THC product.
That makes sense. Thank you. And I know in some of the studies that we're going to look at tonight, we'll talk some about the acidic cannabinoids, but any big hits from what you've seen, in terms of clinical role of THCA or CBDA as distinct from the rest of what we've talked about so far?
Oh my God. I love the acidic forms. I guess I didn't realize how much you were into the acidic forms also. I think they're so exciting and there's so much potential with them. Ethan Russo, I was speaking at a veterinary conference and he was also there speaking. And we were having a conversation over some coffee and crackers. And he essentially, he said there is nothing that these acidic forms there's nothing that these acidic forms can do that these other forms cannot do, which is exciting. Plus they can do more, which is even more exciting. And as you'll see from the studies that we're going to be talking about, the acidic forms seem to be absorbed better, which is really exciting, especially some of their pharmacological actions in the mammalian body.
Thank you. So I'm looking at the chat, but for those of you on the chat, I want you to just know it's kind of hard for Stephen and I to monitor that consistently because it moves so fast. But I did catch one good question from there, which has to do with carrier oils, MCT oil or extra virgin olive oil, potentially causing loose stools or any concerns. Let's just expand this out to matrix in general. Like if you had your own pet line, what would you be using as a carrier for cannabinoids?
Well, in one of the studies that we're going to talk about, we're talking about an MCT oil that has 25% lecithin oil in it as well. So that's a sunflower oil. So that is probably what I would lean on. I think that's very promising. I think MCT oils in general are fine. However, in cats, there's some really interesting studies. Way back in the day, they used to think MCT oil was causing hepatic lipidosis in cats. However, scientists found out that cats really hate the taste of MCT oil. We might not appreciate a lot of taste to it, but animals have different taste buds, right? So they taste things differently. They really, really hate it. And when you don't feed a cat, their liver says, oh my gosh, what's happening? And turns into a fatty blob, essentially. And that can be an issue for some cats. So you may want to lean away from an MCT oil for our cat friends, but in general, I'm pretty comfortable with MCT oils. And then based on the data that we have, throw in some lecithin and I would be happy. There was some talk in some circles and some marketing about LCT oils, long chain triglyceride oils, maybe bypassing some of the liver first pass. Not very good data on that, so I'm not super keen on recommending only that. I'm not against it, but yeah, the data that we have so far, it seems like MCTs work just fine.
Thank you. And I'm sure with cats, the quantity, the volume of MCT probably makes a big difference. And if it's a little bit, it's probably not a big deal. We really must be in the same circles because I've also been learning some about the unpublished research, which from my understanding, what I've talked to with a couple researchers is that this is all ex vivo research, not in vivo, meaning it, performed on tissue that's, been taken out of the animal, not on a living animal, but suggesting that the long chain triglycerides might get into the lymphatics faster and have less hepatic, processing. And maybe there's something to that, but until we know any better, probably all of the above are okay, as long as you don't give yourself or your pet enough oil to have a laxative effect.
Yes, and that's that's an important thing to note. And thank you for reminding me. The Colorado State University study where they were using the 10 and 20 milligram per kilogram dosing for those dogs, the number one side effect that they saw was loose stool. And when I talk at veterinary conferences, people say, oh, see, it's giving animals diarrhea. I'm like, well, it's not the molecule that's giving these animals diarrhea or loose stool. It is the amount of oil that these animals were getting. They were getting a large dose of oil. It was a pretty low concentration of a product. That particular oil was a hemp seed oil, which by and large is kind of a novel oil to most animals and most humans. Like we don't use hemp anymore like we used to. So that can cause some GI upset, not necessarily the CBD or even low levels of THC or other phytocannabinoids in those products.
Thank you. Wonderful. Well, we have lots of good questions on the chat. We have even more questions that were previously submitted on the spreadsheet. We're going to have some live questions afterwards. For those of you that are joining us tonight, please feel free to keep showering us with questions, and we'll do our best to answer as many as we can, but we probably won't catch them all. But now I'd like to just turn to some of the research that we have to present for you, and then we'll circle back around to all the questions afterwards. And so while I present, Stephen, feel free to chime in anytime on anything. Let's do a little screen share. And while I'm getting that ready, I'm sure some of you who were with us last month are wondering how I am and how I have been, because when I gave the last webinar presentation, I had COVID. And so I want you all to know that I'm doing very well. COVID was not that big of a deal for me. I was actually hoping that I would feel it a little bit more. Sorry, I'm just organizing my windows here. But I watched it and just kind of experienced it for a few days. And for me, it basically just manifested as a strange type of a sinusitis that never really got full blown, but kind of lingered. And then on day 5, I started treating myself essentially with ivermectin, zinc, quercetin. I was already on vitamin D. I kicked up the vitamin C a little bit more. And on my second dose of ivermectin, which was 48 hours after the first, my symptoms basically completely resolved, and I never had anything since. My 3 children all had a little bit of a mild fever all on the same day. And then interestingly, 2 of them 2 days later tested negative and 1 tested positive. If that says anything about the test, my wife and I were both positive. This was a pretty mild experience. And like I was mentioning last month, I just felt so blessed to have all the tools, resources, and more than that, just the confidence to know that this is a treatable condition. And it's, I think unfortunate that not enough attention is being paid to how we might treat this instead of just waiting until it gets really bad and then heading to the hospital. So I'll just throw that out there. And for people that are interested in learning more, we did have a nice conversation about it at the last webinar. So now, are we good with my slides showing and the video and everything all together?
Yep.
Okay, great. So I just want to take a little moment also to recognize one of my most beloved teachers. He's an osteopath named James Jealous. He passed away last week, and I've just been reflecting on his life and his death and everything that he gave to me. And I just so incredibly inspired. This man was loving to everyone he met, and because of that, everyone fell in love with him. He was an incredible healer and a great teacher who really took on the, in my opinion, very tough job of teaching doctors to become more compassionate, more connected, to expand their senses beyond just kind of material palpation, and to return to a more traditional type of medicine as an art form. And so he has a website, jamesjealous.com, that lists any osteopathic or dentist or allopathic providers that have completed his series of training. And if any of you are curious about what some highly skilled osteopathic treatment might feel like, or are curious about what it's like if someone were to come see me in my practice and get on my treatment table and receive an osteopathic treatment, then I encourage you to check this out. It's something that can be extraordinarily helpful for people that are suffering with symptoms, but it's also something that's health promoting, and a tune-up, say 2 to 4 times a year of a good osteopathic treatment can do wonders. Now, osteopathy has many different manifestations, and sometimes it might look more like chiropractic, and sometimes it might look more like energy medicine, and this is definitely more on the subtle energetic level, his style of osteopathy, which is called biodynamic osteopathy in the cranial field, or something along those lines. But if you're interested, check it out. Just a huge thanks to Jim. You've changed my life, and his work is living inside of me, and I'm just so thankful to have had the opportunity to spend time with and study with and be mentored by a living pioneer in my field. Really beautiful. This is a picture from 2006, and I didn't even notice until today that I'm there in the background standing by the mirror. Just a beautiful, beautiful moment. So let's dive in here. This is a study on Serum, CBD, THC, and their native acid derivatives after transdermal application of a low THC extract to beagles, so to dogs. And both of these first 2 studies I'm presenting are looking at the pharmacology, pharmacokinetics, which means the absorption and the distribution and elimination of these compounds. And so this was an ointment that was made with an ethanol extract, and it, as you can see, had equal parts CBD and CBDA. So they're already like tuned into our channel here and not fully decarbing their CBD, and then very low levels of THC and THCA. 4 milligrams per kilogram, which I think is a fairly high dose for topical, maybe more than a fairly high. That's pretty high dose for topical, right, Stephen?
I mean, that's a high dose. Yes, it is.
Okay, so that was rubbed into their ears twice daily for 2 weeks. And so this is what was found. At the end of week 1, you can see the serum levels of CBD and CBDA and THCA. And the reason that THC isn't on this graph is because they weren't able to detect it at all. So first of all, this is showing 2 things. The acidic cannabinoids are better absorbed into the systemic circulation through a topical application than their neutral counterparts. So CBDA better absorbed topically than CBD, THCA better absorbed topically than THC. I think that's the biggest finding here, and that these really can be applied topically and get into the system. I'm just quoting the authors here. They said that CBDA has been shown to be an anti-inflammatory with direct cyclooxygenase inhibiting capabilities in cell culture and preclinical models. What that translates to is that it has a similar mechanism of action to the non-steroidal anti-inflammatory drugs, or it might anyways, unlike CBD, which does not seem to have that property, potentially making CBDA a better choice for clinical study of local and systemic disease using transdermal approaches in veterinary medicine. The only adverse effect was ear redness in 3 dogs, and this did contain ethanol, and so maybe without the ethanol that might not have been as big of an issue. What are your thoughts on this study, Stephen?
Well, I know this group well. Joe Washlag is a good friend of mine, and it is exciting. And I think what's interesting about this particular study, even though, for the week 2, we only got up to the 30 nanograms per milliliter in the serum of CBD, A in particular, there is some argument as to what actually is a therapeutic dose, right? Like, we don't know what that defined concentration in the serum needs to be for that beneficial effect. And certainly with a concentration getting up to 30 nanograms per milliliter, if we were to apply this over a particular area that does have inflammation, say a joint or maybe some form of dermatitis, where it wouldn't be contraindicated to put something on that open skin, could have some really good benefit here. And what's interesting is we actually did a follow-up study to this one. It's not published, but we used different carriers for these particular molecules, the CBD, CBDA, and found a lot better absorption. So I think depending on the carrier for these topicals, we will have better success or less success depending on what we're using to get into these animals. And it is important to note that it does seem that permeability enhancers certainly seem to be helpful, but obviously with animals that tend to lick things off of themselves, we have to be a little bit more cautious with what we're using. With that said, there are some salves and stuff like that that are using whether it's a whipped hemp oil or whatnot, that we can also put on topically. There is a benefit to having that animal lick it off sometimes, and that they're just getting systemic uptake as long as the product is safe for them to consume.
Thank you. And I think your comments about, what is the therapeutic blood level of a cannabinoid? And I strongly suspect that in some conditions there might be a therapeutic range, and in others it's just all over the board. Yeah. And of course, epilepsy as an example, well, epilepsy isn't just one condition, and that's probably why, but the vast majority of research looking at CBD and blood levels in epileptic patients, it's hard to pinpoint where's that therapeutic range. It's all over the map. I think there was one study that kind of narrowed it down a little bit in one patient population, and that's probably what it's going to take. And I doubt the resources are really going to be invested into the research to figure out what animal, what species, what condition, what subset of that condition, and what's the therapeutic blood range. But who cares, because we're not going to be testing their blood outside of the research, and I think that the biggest question that could be answered is, can we have a systemic effect feasibly from a topical application? I think the answer is yes. And I don't have a lot of experience getting medicines into pets, but I think since we're there now, maybe we could talk about, is there a situation where you would lean towards topical application instead of oral if it's not just a localized topical problem, localized kind of surface level problem?
Yeah, so dogs tend to be a lot easier to dose things orally with. So dogs aren't usually a big concern for me. But when it comes to cats, cats just don't like you touching their face. They don't certainly like you putting a finger down their throat, trying to shove a pill or capsule or whatever. When you put oil in their mouth, they usually foam and kind of look at you and shake their head and get very irritated. So I think cats is definitely where topicals are of most interest. And then certainly there are other conditions that are localized, like MCT, mast cell tumors. Is a particular area of interest of mine where I do at least feel clinically we've seen some success with topical application of cannabinoid products.
Great. All right, let's move on. We have another study, and you were a co-author on this study. We're still working with beagles and still looking at pharmacokinetics, but this time it was oral dosing using 2 milligrams per kilogram of combined CBD and CBDA. So that's 1 milligram per kilogram of each. Which is, a little higher than the starting dose we talked about, but definitely in that therapeutic range. And you compared 3 formulations that we'll detail on the next slide, and basically looked at the blood levels over the course of 24 hours and then after 2 weeks of consistent dosing. And so these were the different formulas. One was 25% medium chain triglyceride oil and 75% long chain triglyceride, which was sesame. And I didn't put it on the slide, but for those of you that don't know, most of the MCT comes from coconut. So both, kind of hypoallergenic oils. The second formulation was similar to the first, but it had sunflower lecithin in it instead of the MCT oil. And for those of you that don't know, lecithin is something that's found in many plants, but it typically is derived from soy and sunflower. It's an emulsifier, which means that it has a polar side of the molecule and a nonpolar. It's very similar to what you would see in our cell membranes. And this is something that allows it to be soluble in both water and oil. And it's the thing that can get water and oil to mix. And it's also, really useful in baking. If you're ever creative in the kitchen, you want oil and water to mix, say like in a salad dressing or a number of different recipes, lecithin is one strategy to do that. And then the third formulation was soft chew with 5 milligrams each CBD and CBDA. And up here you can see the per milliliter potency of these other 2 oils. So let's take a look at, and so I'll just comment, fairly potent, right? Total potency up around 60 milligrams per ml, which I think is better in general for people and pets. Our healer formulas are at 50 milligrams per ml. It's just nice to be able to have precise dosing, but also not need to take a huge volume of oil. And so, oh no, my animations didn't work. Bummer. I kind of pasted too much on top of everything here. Let me exit out of here and see if I can just fix that real quick. I think I can. All right.
Can I answer some questions? I saw one come up and I kept wanting to touch on it.
Yeah, please do.
So Tamara Wilton was asking about birds, and I saw her little bird crawling around earlier, and she's feeding it a carrot, I think. So birds are interesting, and there are actually multiple studies in birds, different species of birds, and it seems like birds are needing much higher dosages compared to what a cat or a dog would use. So typically, if I'm recommending a product to a bird, instead of recommending 0.5 milligrams per kilogram, like we would do in a cat or a dog and work your way up, I would actually start at 2 milligrams per kilogram, because it looks like most of the PK studies or the dosages for birds is going to end up around 8 milligrams per kilogram. So it's pretty high compared to dogs and cats. And for horses, oddly enough, require pretty small doses compared to cats and dogs. And so horses, I actually drop it down to 0.25 milligrams per kilogram. We can put that in a paste. There's a great company that's making some oats and some flaxseed that has CBD in it, which is really nice for dosing those guys. I'm wondering if this hind gut fermentation has anything to do with that, or if horses are just very special creatures in general, if their physiology is just not requiring as much compared to cats and dogs.
Thank you. Incredible information. I'm feeling so grateful to have you on tonight, Stephen. So these are the 3 different formulas in their 24-hour pharmacokinetics. And I think if you just glance at these 3 charts, you'll see they're not drastically different. They're all looking pretty similar. And what stands out is that big red peak, which is the Cbda, which, as you can see, goes about 3 times higher than the blue peak, which is CBD. And so we already told you that Cbda was better absorbed, and now you can clearly see that. Before I move on, Stephen, anything else that you want to point out about these 24-hour profiles?
I don't think so. I believe that the Tmax for the chews was greater compared to our oil forms, which might be nice. I mean, I'm a big oil guy, and I give it in food. So in general, that's kind of a conversation we have to have all the time. Should we be giving this oil products with food, or wait 2 hours before or after? It looks like the evidence right now is showing us we can give it with a small meal, and that does help with absorption.
Right. And so I think, just to point that out, if you look at this bottom curve here, you'll see that the peak of the red line is a little bit over to the right. So it occurred a little bit later. And I believe that when you guys looked at the area under the curve, which is the total that was absorbed, it was a little bit higher in the chew form.
Yeah.
Okay, so then now what I've put up here is this is the level after 2 weeks, correct? Did I get that right? Okay, so again, we have 3 different formulas. We have no major differences, but I think you can see a little bit of difference down here in the chew with some better CBD pharmacokinetics, it looks like. But in general, this is all pretty similar to what you saw acutely. Am I right about that?
Absolutely.
Okay. So these are the 1 and 2 week serum cannabinoid concentrations, and this was drawn after like a trough, right? I believe it was 6 hours. So it was enough time for them to kind of digest, absorb, and start to eliminate, and it was consistent across everything. And so this is broken down by cannabinoid this time instead of by the formulation. And you can see over here CBD on form 2 stood out a little bit. Again, that was the one with the lecithin, as having a higher concentration on week 1 and again on week 2. The Cbda also seems really prominent in that lecithin formulation, and this was statistically significant difference from the other 2. That's what the little star is indicating there. And slight differences in THC. Again, the lecithin formula seems to stand out. And in the THCA, it was the straight oil that performed less than the sesame oil or the chew. And I suspect that the chew also has some, I'm curious to hear your thoughts on this, but I know that sometimes when we take just a little bit of oil with a medicine in it without food, that wouldn't be enough to kind of turn on our digestive system and have us excrete bile and enzymes to help break down that and absorb that fat soluble content. Whereas the chew, I'm sure, is enough to get that salivation going, turn on the gut, and get the bile flowing. And so I wonder if that was a significant difference there, and if you have any other comments on this data.
Well, yes, I'm sure we all remember learning in junior high of the Pavlov effect, right? The salivating dog when there's a food stimulus, and those chews smell like peanut butter. So we get that effect, we get those enzymes going, we get that GI going. So absolutely. Plus, you have the benefit of having the oil in that chew as well.
But this is a really interesting lead. I think, the lecithin makes sense. I've had people use lecithin in formulas all the time. It can kind of increase, I guess we could just say change the palatability. It doesn't have a bad taste, but it ends up being more like a thicker, creamier type of a thing, right, than just an oil. And I'm curious to hear if people have experience adding lecithin to their cannabis, what that's like, you could comment on the chat. So just to summarize, CBDA was absorbed at least 2 times better than CBD. It might have been absorbed more because that peak might have occurred in between 2 measurements. It seems like that's possible. The CBD and CBDA concentrations over 75 nanograms per milliliter suggest a therapeutic potential at this dose. We already talked about, well, what is, therapeutic blood levels, but certainly that's going to be high enough to have some impact. And then the THCA was found in pretty decent levels in the serum. And I just want to go back and point out that if you kind of look here, there's a different y-axis, so these charts aren't all comparable, but you see the THCA in between 20 and 30 nanograms per milliliter. Remember that there were like 1/30th of the level of THCA in these formulas compared to CBDA and CBD, which is mirroring the one pharmacokinetic study we have for oral dosing of THCA in humans, which also showed this incredibly high oral bioavailability. And so I just really want to emphasize they weren't receiving the same dose of THCA and CBD, actually quite a bit less THCA, and it seems to have probably had the best absorption out of any of these when delivered orally. All right, we're going to shift away from pets to humans just for a little bit. This is a randomized controlled trial on a cannabinoid treatment for autism. And we've presented similar findings over and over again on this webinar, but I think the difference here is that there was a placebo control. There were 150 patients with autistic spectrum disorder and either moderate or greater behavioral problems. And they were divided into these 3 groups, which, as you can see on this kind of explanation of how the study was run, which makes a lot of sense, 1/3 of them received placebo and then were switched to the whole plant extract, or 1/3 of them received the pure cannabinoids, which was basically just the CBD without everything else in it, and then switched over to placebo, or another group that had the whole plant extract and then switched over to the pure cannabinoids. So a really nice comparison of these 3 treatments with 4-week washout in between. And they were treated for 12 weeks and administered all sorts of measures on how are they doing with their behavioral problems, as well as their core autistic symptoms. So this was the intervention. It was a CO2 extract that was either immediately dissolved in olive oil, that was called whole plant, or further purified to what they considered 99% pure CBD, and then dissolved in the olive oil. And that final preparation of the pure cannabinoids had no terpenes, flavonoids, or minor cannabinoids in it. The final concentration was quite high, as you can see, 167 milligrams per milliliter of CBD and 8.3 of THC. So not an insignificant amount of THC. And I will say that the THC was present in the pure cannabinoids formula. So the THC wasn't removed, just the minor cannabinoids, the terpenes, and so forth. And so the starting dose was 1 milligram per kilogram per day, a little higher than I would start in the clinic. In many situations started a 1/10 or a 1/5 of that. And that does contain, I think this is really important to point out, 0.05 milligrams per kilogram of THC, which is where I start with THC anyways. This is, if I was treating someone with just THC, this would probably be my starting dose. Increased by 1 milligram per kilogram of CBD every other day. So I would consider that an aggressive titration schedule. So they started pretty high and they cranked it up pretty fast, in other words, which is, that's fine. They were doing 12 weeks of research and they wanted some data here. They went as high as 10 milligrams per kilogram for the smaller children and as high as 7.5 milligrams per kilogram on the CBD side for the larger children. And again, you can see that the doses of THC are not insignificant. So the maximum was 420. I think they just randomly arrived at 420 for that one, and of the CBD, and then 21 milligrams of the THC. So I think this is a significant dose of THC for most people, including this patient population, divided into 3 times daily dosing. What were the adverse effects? Nothing severe or serious. The mild adverse effect profile was similar to placebo with a couple exceptions. Somnolence, so feeling sleepy, was more common in the cannabinoid group, and decreased appetite, weight loss, and anxiety were a little bit more common in the cannabinoid groups, but I think it was the somnolence was the only one that was statistically significant. So these are some of the results. And so, you know, this chart here is basically just showing you participants who had behavioral problems that were either much improved or very much improved. And this is about the, this is the CGI-I scale, the Clinical Global Impression of Improvement. And so this is kind of a clinician rated level of improvement. And you can see here that there was a significant difference between the whole plant extract and the placebo, and just a little bit of a difference between the whole plant extract and the pure cannabinoids. And I'd say this is exactly what I would have predicted, and what my clinical practice has shown me over the years, is that whether it's a CBD isolate or whether it's dronabinol, you can still get good results with that. And the results are not only good, but similar to what you might see with an artisanal or a broader spectrum product, but they're rarely as good. It's usually a little bit better at a little lower of a dose, so, and then more cost effective when we use some of these broad spectrum products. Now, what was interesting to these researchers and to myself as well is that the SRS-2, which is a measure of a core autism symptom known as social responsiveness, also improved in the whole plant compared to placebo. And again, that was better than the pure cannabinoids. And I say that that's important because if you look at autistic spectrum disorder, there are basically 2 approved treatments for these behavioral issues, and they're both antipsychotics, and they both have a significant adverse effect profile, but there's really no pharmacologic treatment for core autistic symptoms that have been broadly embraced. I think if you talk to people working with autism, they'll tell you otherwise, that there are treatments for that. But as far as kind of the official opinion and certainly any FDA indications, there's nothing that treats these core symptoms. And in this study, the CBD dominant extract with some THC in it did that. So why is this important? This was placebo controlled. I think it adds validity to parents of autistic children that want to treat them. Now we have placebo controlled kind of gold standard, even though it was a fairly small trial. 150 is not tiny. There was a decrease in disruptive behavior with a trend towards weight loss, which is very different than the atypical antipsychotics that are approved, because those tend to cause obesity and metabolic syndrome. And sometimes they work at first and then stop working. And I've just seen this so many times over the years in my practice, where someone with autistic spectrum disorder has been treated with atypical antipsychotics. They've gotten a little bit better, stayed on the treatment, then this antipsychotic stopped working, or maybe they needed some dose escalation of it. And what you end up with is, a couple years later, a young person who is once again aggressive, agitated, violent, but now they're double their size because they put on all this weight, and the amount of parental and sibling abuse that's going on is much harder to tolerate with a much bigger child. And so for a treatment to be effective for these symptoms and not have this obesogenic effect, but actually to reduce weight, could be useful. But also I think anyone who's underweight needs to take caution with high dose CBD, because I have seen it decrease appetite in my patients. And according to the researchers, they did not find clear advantages for the whole plant extract over pure cannabinoids. And so that statement comes from the fact that this was not statistically significant. But as you can see, outside of statistics, it still looks like it's working quite a bit better. And so I think I would say either works. And if you have the opportunity to use the whole plant, that's probably a nice place to start. Okay, next study, cannabis, and this one made a lot of headlines. Cannabis is associated with blood pressure reduction in older adults, a 24-hour ambulatory blood pressure monitoring study. And this reminds me of an early publication from the late 60s that Andrew Weil, another one of my beloved mentors, performed with inhaled cannabis. And it wasn't a 24-hour ambulatory study, but he basically just asked the question, what effect does cannabis have on cardiovascular parameters? Something worth researching, since a lot of people are using this. And so this takes it to the next level. Oops, I seem to have hit the escape button by accident. Let me get back. This takes it to the next level because this was 24-hour ambulatory monitoring, which provides a lot more data. That means that several intervals, the blood pressure was measured in a 24-hour period. And so this was 26 patients that had high blood pressure, but they were already treated with prescriptions. The majority of them were using ACE inhibitors and angiotensin receptor blockers, the ACE inhibitors and the ARBs, and some were using other agents. The mean average age was 70, 53% female, and they all had this cardiovascular and laboratory evaluation at baseline, and then 3 months after initiating cannabis. So they were recruited from different treatment centers, mostly chronic pain, but also oncology. And the vast majority of them were using cannabis to treat pain, which of course is a major confounder, because if somebody's pain is better, their blood pressure is probably gonna get a little lower as well. Let me just pull this over. Oops. So what did they find? So just in terms of the treatment that they were using, 20 were using just oil taken by mouth, 4 smoked their cannabis, and 2 used both. 1/3 of them were using it once daily, about another third were using it twice daily, and another third 3 times daily, so there was a split there. The median THC dose, so median means like the middle number, was 21 milligrams per day, and you can see the range of the THC dose here. So they weren't tiptoeing around THC, which I appreciate since most of them have pain. And the range for CBD was very similar, and the median was also similar. So on average, about 20 or so milligrams of CBD and THC per day. What were the results? 18 patients had some degree of improvement in their symptoms. 6 of them defined it as significant, so about 70% response rate to the primary symptom that they were being treated for. 6 patients reported no change, and 1 patient reported a deterioration following their treatment. And then you can see the adverse effects here, which look pretty much like they look like in many other cannabis studies, where dizziness is the most commonly reported, followed by dry mouth, fatigue, palpitations. Constipation is not that common. And then psychoactive sensation, meaning they felt funny, and 0 adverse events, which is a trend here. And so this is a measurement of their blood pressure. And so we have 2 blood pressure readings, the systolic, which is when the blood is pumping, and then the diastolic, which is the amount of pressure in the vessels in between those pumps. And you can see the blue line is the systolic pressure before cannabis treatment, and the orange line is after. And so this is an average amongst participants. You can see the same thing in the diastolic. The purple line is before, the red line is after. And this is the average of that 24-hour measurement period and the average of all the participants. And so I just put the numbers over here as well, so you can see what this translates to, which is essentially about 5-point reduction in systolic blood pressure. So you can see the average went from 135 down to 130, and then the diastolic average was about a 4-point reduction. A little more than that, went from 69 on average down to 65. So what I want to point out, first of all, is that these starting numbers, the blue and the purple line, these aren't people with incredibly high blood pressure, right? They have hypertension, but they're already being treated, and the average blood pressure is a little bit higher than the normal, but it's not like way up there in dangerous zone. And I say that because I suspect that the results would have been more pronounced if these people had more out of control blood pressure. And that's because in general, the endocannabinoid system has a stronger effect on physiology when that physiology is further away from its kind of homeostatic set point. Then the endocannabinoid system seems to act in a stronger way. Mean arterial pressure went from, this is nice, this is an average, which can, be associated with all sorts of prognostic indicators and various cardiovascular diseases, looking at mean arterial pressure. And that also, went down by about 5 points. And so according to a 2010 review article, the threshold for a reduction in blood pressure resulting in a decreased composite cardiovascular endpoint, meaning, if we look at all the negative cardiovascular outcomes that might arise from hypertension, and if we were to reduce blood pressure in a group of people, by how much, how do we affect those? And kind of the threshold for that is 4.6 millimeters of mercury for systolic and 2.2 for diastolic. So this treatment, which was a treatment for pain, actually reduced blood pressure in this cohort at a level that would have reduced their risk of a negative cardiovascular outcome. And I think that's significant. I think a lot of people that hear, oh, it was 5 points lower in systolic and 4 points in diastolic on average, they might say, well, that's not a big deal. Well, it actually is. That improves their likelihood of being free from these conditions. There were some other results worth mentioning. The nadir, so kind of the low point in blood pressure, occurred on average 3 hours after they consumed cannabis. These patients had no significant changes in their lipid profile. Now, this is over 3 months. Their hemoglobin A1C, which is an average blood sugar, their fasting insulin, which is how metabolically flexible they are and if they have insulin resistance, C-reactive protein, a measure of inflammation, kidney function tests, electrolytes, their body measurements, and their ECG. No significant changes found among any of those, which is a little surprising because there is a lot of data showing that cannabis users tend to have better metabolic flexibility, lower insulin resistance, lower metabolic syndrome, lower inflammation. And maybe if they end up following up with this cohort after a year of treatment, they'll find some signals there. But one thing that did stand out is that the fasting glucose significantly decreased, but only among men. And the average went from 115, which is above normal, down to 99, which is in the normal range. And so, and this is the first that I remember seeing that the kind of blood sugar modulating effects of a cannabinoid treatment or of the endocannabinoid system would be more pronounced in one gender than the other, but maybe there's something worth following up there. But this would be a nice result. If I'm a clinician, I'm looking at someone whose fasting blood sugar is 115 and I'm trying to help them avoid becoming diabetic, getting it down to 99 would be a major win. Now, what else is happening here? Well, these people are in less pain, at least 70% of them are. They're probably sleeping better, they're probably laughing more and doing all sorts of things that end up reducing stress, reducing their cortisol level and reducing their blood sugar. At least that's my assumption. All right, last study for the night, we have cannabichromine or CBC and some associated compounds in a mouse model of epilepsy. And this is a specific mouse model of Dravet syndrome, which is a severe debilitating epileptic disorder. And of course, became famous with Charlotte Figi and was the kind of original indication of Epidiolex in the United States. And so this study is very similar to two others that we've presented in recent webinars. The last one looked at THC and THCA in this and other models, and that was fascinating. If any of you are interested in that, it's in the webinar archives. So what did they find? First of all, the author said, knowledge on the pharmacological activity is extremely limited for CBC and virtually non-existent for these other cannabinoids. So these are the other cannabinoids that they looked at. And I show you the molecular structures here so you can see the similarities and differences. But this is CBDV, cannabidiolverin, which has a shorter carbon chain here. You can see this is a 3-carbon chain instead of 5, so that's why it's different than CBD. Here's regular old THC and THCV, the same kind of difference. Here's CBC and CBCV. Now, these researchers also looked at the acidic forms. And I know Jonathan Arnold, we've been communicating for several years about acidic cannabinoids. And, it's been a wonderful kind of collaboration. And so I'm thankful that their group, and they're out of Australia, is including acidic cannabinoids. They're very interested in, do the acidic cannabinoids get into the brain and do they have anticonvulsant effects? So they also looked at CBCA, CBCVA in the study. And the difference between the acidic and the neutral, just so you can see it, where this R is here, there could either be a hydrogen, that would be the neutral, or there could be a carboxylic acid group, the COOH would be there. And that's the only difference, but that carboxylic acid molecule does make a big difference in its function. So what do we know about CBC? There's one study that showed it's a CB2 receptor agonist. It seems to have little activity at CB1, but there's a little bit of data that shows that it can potentiate THC, so maybe make THC's activity at CB1 a little stronger. And it's a potent agonist at the TRPA1 channel, which is an ion channel. But as these researchers said, we know very little about CBC. So what were the results? First question is, does this stuff get into the brain? And the answer is generally yes. And the measure of that is the brain plasma ratio. Now, I want to say this may not be true for oral dosing, because these are rodents. They were injected with these into their abdominal cavity, and the cannabinoids were in a vehicle called tween 80. And it's been shown in previous studies that injecting cannabinoids in tween 80 compared to a different carrier actually improves their penetration into the brain. And so, but again, this is early research, and we're just looking for some leads, because I think people want to know what minor cannabinoids might make a seizure formula more effective. Could CBC or could CBCV or CBCA be a part of this, even though we don't have a definitive answer? So this is the first research, almost the first research that's looked at this. There was a little bit in the late 70s that didn't tell us much. But anyways, this brain plasma ratio for CBC is pretty high, 0.8. So if it were 1, that means we see the same level of CBC in the blood as we see in the brain after injection. And so 0.8 is pretty high. A lot of it's crossing the blood-brain barrier. It's a little lower for CBCA, which we would expect because it's a more polar molecule and has a little bit harder time crossing that blood-brain barrier. CBCV crossed extremely well. There were higher levels in the brain than there were in the blood, and CBCVA still crossed, but not quite as well as the others. Now, what about their anti-seizure capacity? So this is a model of seizures where you gradually raise the temperature of the rodent, and when they get hot enough, they have a seizure, and you can measure the temperature that caused the seizure, and that gives some indication of whether there was an anti-seizure effect related to the treatment. And so you can see here, this is the control, and you can see the temperature a little over 41 that caused the seizure. 10 milligrams per kilogram of CBC injected into the abdomen did not change that compared to control. 30 milligrams per kilogram also did not change that, even though it trends towards like worse seizure control, which is interesting because the temperature is lower. But 100 milligrams per kilogram injected, a high dose even for rodents, did statistically significantly improve their seizure threshold. So there was an anticonvulsant effect of CBC at this high dose. But I will point out that in the same animal model, this is the dose required for CBD to produce an anticonvulsant effect. And CBD did end up working in humans with Dravet syndrome and getting approved for treating this condition. So the early preclinical data looks just like CBD for CBC in this particular model. CBCA also produced statistically significant improvement at only the highest dose, 100 milligrams per kilogram. CBCVA, same thing, at 100 milligrams per kilogram was helpful, but CBCV was not, which is so strange because it crosses the blood-brain barrier so well. And what I'm wondering, and I haven't written them yet, is if they would have tested 1 or 0.5 or 0.1 or 0.01, like what's happening here in between 0 and 10? Maybe it's crossing the blood-brain barrier so well that a smaller dose would have hit that sweet spot, because a lot of you that are familiar with my work and have been through the training curriculum understand these biphasic effects where there can be a low dose that's effective and a high dose that's not effective. And so that maybe that was happening with CBCV because it was crossing the blood-brain barrier so well. Who knows? Something worth exploring. Then they also fluorinated CBC. Fluorinating a compound makes it more electronegative. It definitely makes it better able to cross into the brain. I'm not a huge proponent of fluorinating our cannabinoids, but at least this research was done. It had a higher brain plasma ratio than the regular CBC. It went up to 2.7, and regular CBC was 0.8. So it kind of tripled the brain penetration. But even though it tripled the brain penetration, it still required 100 milligrams per kilogram to work. The researchers were thinking, well, if we can get 3 times as much of it into the brain, maybe we can use 1/3 as much as a therapeutic treatment, but didn't turn out that way. So probably the actual mechanism was altered by the fluorine, not just the ability to cross into the brain. And that is the end of my slideshow. Let's get back to our conversation here. Wow, we've done a lot. Where are we going next? Thank you all for hanging. I hope it's been good. Let's keep going with some questions. And so if you want to ask a live question, you can say that in the chat, and Simone will kind of put you in the queue. I'm going to go to take our first one for previously submitted, and then we can get whoever's next for a live one. So this first question is that one that I hear a lot about people, but this is one for dogs. Question about suppositories due to avoiding first pass metabolism in the liver and not getting dogs as high. I mean, it's just the same question I've answered so many times for people. And other general questions about treating cancer. Is there like a milligram per kilogram range that you think about, Stephen, in not just relieving the symptoms, but actually directly treating the tumor? And if you don't have experience with that, that's fine too. Oh, unmute my friend Stephen, please. Okay. I don't know. Oh, there you go.
There we go. There we go. Yes, of course I have something to say about this one. There are some really interesting studies that recently were published. They were in vitro, so they were in a petri dish, and they were looking at different cancer cell lines and the ability for CBD isolate, CBDA isolate, and then a full spectrum product killing those particular cells. It's called an IC50 test. And what cancer cells they were specifically looking at, in dogs at least, were lymphoma, osteosarcoma, and mammary carcinoma. And what was interesting about those particular IC50 tests is the osteosarcomas seem to be fairly responsive, which I would say anecdotally seems to be very responsive as well. As far as dosing goes, if we were to scale what we used in those IC50 tests for the specific cell lines to a dose that we would give a living creature, it would be a pretty high dose. It would be something greater than 7 milligrams per kilogram or higher. And there was another abstract published. I don't think there's a paper out on it yet, but again, with Dr. McGrath's group looking at glioma cancer cell lines in a petri dish. And CBD in particular was helpful in stopping proliferation and stopping and killing those particular cancer cells. And if that were scaled, that would definitely be higher than 7, maybe even 10 milligrams per kilogram. And then we have that nuance of what carrier is it in? Is it going to cross this blood-brain barrier to even get to those particular cancer cells up in the brain? When it comes to suppositories, I'm sorry, that was a...
No, that's good. I mean, it's a similar answer that I think we're used to. Yeah, it looks good.
I took you for a tour there. Sorry about that. For suppositories, theoretically, yes, like that is something that we could do. Your animal will probably end up hating you, trying to stick a suppository up their butt every night. Plus, you would probably get anal glands all over your hands. If you're not familiar with anal glands, and dogs and cats have them too, they're the worst things in the world. And they release them when they're stressed out or angry, and they are stinky. So that can be a problem. So unless your animal has like a form of prostate cancer or prostatitis, like I would probably just stick with oral dosing. And certainly if you have things like a mast cell tumor, I would do oral and topical application at the same time.
Thank you. I did just see one come across the chat from Honey Smith saying that, wondering, since reptiles don't have an ECS, would you recommend cannabis as a therapy? But my understanding is that reptiles do have an ECS.
Absolutely, they have an ECS. There's some actually really interesting toxicity studies with THC in green iguanas. So yes, they absolutely have an ECS. Insects, I believe, are really the only creature that we have where they don't have a complete ECS, right? So they don't have these CB1, CB2 receptors, but in this divergence, they're still producing those endocannabinoids, and they're using those endocannabinoids more similarly to prostaglandinoids that we create for our normal physiology.
And I do have a little anecdotal experience that doesn't mean much when treating a reptile, because we have a bearded dragon that had this incredible adventure of getting out into the wild in June, I think it was. And we, kind of all said goodbye and grieved the loss of our dragon. And then 3 or 4 months later, I think about a little over 3 months later, a friend of ours saw a post on Facebook from someone in the same town as us that they found a bearded dragon in their driveway. And it made it back to us, and Star of the Dragon returned home. It was an incredible. She had crossed 2 major roads and been through about 6 miles of woods. And when she came back, she seemed well fed, but she had significant bone disease. She had rickets, probably because there wasn't enough light in the forest for her. Not enough UV light and vitamin D. And so she was pretty sick. And when we were nursing her back to health, we gave her just a little bit of the perfect balance, the balance formula, which is little CBD, CBDA, THC, THCA, because she wasn't eating. And it actually did seem to stimulate appetite a little bit. And we got some lima beans in turn. She eventually came around, and she's done a beautiful job of healing. She's almost back to normal. And it's, it's beautiful to watch her bones remodel and kind of return to their normal shape, and her joints start moving again. So that was the great adventure of Star the Dragon. Let's
That's awesome. And I have some postulations. I don't have data for this so far, but when it comes to those bone deficiencies that we see in reptiles because of poor diet and lighting and whatever, I guess it's because this kind of also answers a question that I saw in the chat about particular liver enzymes going up, in particular ALP, which is a liver enzyme in dogs that can go up at higher dosages, especially in older dogs. There have been some interesting studies, at least in rodents, where the addition of phytocannabinoids, in particular CBD, does seem to stimulate osteoblastic activity. And there's even pharmaceutical companies looking at synthetic and natural phytocannabinoids for alleviating things like osteoporosis. So, is this ALP going up because there's new bone formation going on? Maybe that cannabis product you're giving your lizard was actually helping with bone density. So I think it's really interesting, and again, just one of the amazing potentials of this plant.
Absolutely, yeah. The ALK-FASTA ALP is a very non-specific marker. It could mean something good is happening. And I had recalled, a rat study, I think it was, where they fractured the femur and saw that it healed faster in the presence of CBD. Yep. And I was thinking, well, let's nudge her appetite along and her bone healing, and who knows if it helped or not, but it seemed to. All right, do we have a live question, Simone?
Yeah, we do. Vicky has a question for you.
All right, Vicky, when you're see the unmute, go right ahead.
There she is. Vicky, are you there?
Okay, well, while Vicky's getting ready, I'll go to the next one, and then Vicky, you just stay unmuted and stay on, and you can ask your question when you're ready. Well, so this next one is just a basic question to clarify. Wendy was asking, is there this biphasic response with THCA but not CBDA? And I know where you got that, and there was one study that looked at CBD and CBDA. Oh gosh, now I'm forgetting the details of it. But the answer is any of these cannabinoids, I think, have their sweet spot. So even if one study doesn't measure the range that shows that biphasic effect, it could still be there just outside of the dosing range that was studied. So I can't say for sure that THCA or CBDA has that. Well, I can say for sure, because I've definitely treated people with THCA where too little or too much does not work as well as just right, the Goldilocks effect. And I suspect the same is for CBDA, but hard to know. Okay, Vicky, are you with us? Maybe not. All right, shall we queue up the next live question, Simone? And I'll dig into one more from the spreadsheet here. So this is Rhonda asking about her 12-year-old Malt Shiz, who is diagnosed with low-grade MCT in her hind paw. Not any lymph nodes since October of 2019. She's on a low dose of prednisone, Benadryl, omeprazole, turkey tail, probiotic, and an enzyme. And she was doing great. Oh, I feed her Dr. Harvey's Paradigm and Stella and Chewy's Raw. She was doing great until last week, and then noticed a knot in her, maybe a lymph node, constantly licking paws. Just bought Canna Drops, which includes turkey tail. Previously had a 1-to-1. And then the question is, am I using the right cannabis and CBD? And I read the whole thing because I think this is what people are thinking. This is a great example of what so many other people want to know. Here's a symptom. We don't know what it is. There's paw licking, which obviously means something is going on there. I'm sure you probably can't really comment on the brand necessarily, but maybe part of this question is start with CBD or start with this 1-to-1. And I already asked you that, but let me toss this to you now, Stephen.
Yeah, it is hard to answer that question without looking at what is in this particular product. So it makes it pretty difficult. But by and large, for MCT, there certainly is evidence that things like CBD and certainly THC can help with that. It is important, I think, to get a certificate of analysis to see what's in there as far as phytocannabinoids and terpenes for that matter, especially in cancer patients, or especially if you have an animal that has renal disease. Appetite is very important, and certain terpenes like humulene can be appetite suppressing. So, we also want to make sure that we are blaming the right culprit if things don't necessarily go the way you want them to when starting a cannabis product, because it really depends on that formula that the animal is getting.
Thank you. Great answer. All right. We got a live one?
Yeah, we have Tamara has a live question.
Okay.
Hello.
No.
So I had a question about with parrots. So I do give my parrot a bit of CBD, but I was wondering about hormones. I've heard about it with hormones. Do you have any experience with hormones and CBD, and how much you would recommend?
Giving supplemental hormones?
No, CBD for helping with hormones.
Oh, okay. I was like, oh, you're giving hormones.
No.
I don't have a lot to comment there. I think we need to be careful with higher dosages, especially because we know, even CBD can affect the immune system at higher dosages. So I think that is worthwhile to consider for endocrine kind of things. There is an interesting study, and I'm happy to send it to you, with songbirds and how endocannabinoid levels change when they're singing and when they're stressed out. And then there's also a change in certain hormones, in particular cortisol, during stressors, during singing. So there is some evidence out there, not a lot. Unfortunately, in veterinary medicine, we're lucky if we have a study that has like 20 patients in it, and we're even more lucky if the study is done in something outside of a cat or a dog. Unfortunately, just like in the human world, if there's not a lot of money-making potential behind it, there's not a lot of interest in funding it.
Thank you.
Awesome,
All right, we'll
thanks.
jump back to the spreadsheet, and then if there's another live one, Simone, you can cue them up. Can you tell me something about a pit bull who was diagnosed with epitheliotropic lymphoma? And the question is dosing. This person must live in Maryland because they have access to the perfect balance formula, which is equal parts THC, CBD, THCA, and CBDA. But I think we've already kind of covered the dosing thing here. And also, I think I just want to, remind people that, and this is covered thoroughly in the Healer curriculum, that the dosing for symptomatic relief of a person, and I suspect an animal with a cancer, might be very different than the dosing required to potentially impact the cancer directly with anti-cancer effects. And I think it's important to clarify what the goal is and what the strategy is. And usually what I'm recommending is treat the symptoms, help someone improve their quality of life, or help this animal improve the quality of life, and see if they're more playful and sleeping better and eating more and all of that, and then see if there's a response in terms of an anti-cancer effect. And if not, then you could consider a plan B, which might be a higher, more aggressive dose. Would you agree with that, Stephen?
I absolutely agree. And I think certainly I did not mention that earlier. Are we dosing for anti-neoplastic effects, or are we dosing for symptoms? Because those are two very different dosing schemes there. And just speaking to this type of lymphoma in particular, there is some really interesting work in cats and dogs now looking at diseased dermal tissue and the proliferation or increased numbers of endocannabinoid system receptors, specifically CB1, CB2, and TRPV receptors, which you had mentioned earlier. So, I might be inclined, just like MCT, to even try a little bit of topical along with systemic. But again, it's hard to dose without knowing the actual formulation.
Yeah. Great, thank you. Okay, do we have a live question?
So I have a question from Jeff, but he asked me to read it out.
Okay, sure.
He wanted to ask Stephen if he's familiar with using cannabinoids for treatment of valley fever, and if you ever reverted to cannabinoids when fluconazole doesn't work.
Yeah, that's a really interesting question. No, I don't. I haven't seen those types of cases. That is a pretty severe fungal infection, and it often affects the bones, and it oftentimes gets misdiagnosed as osteosarcoma as well, which is unfortunate. I have not seen any data for that specifically, and even really anecdote. I would be cautious, though, in particular with antifungals like fluconazole and itraconazole and their CYP450 effects, and how this might affect your dosing with the cannabinoids as well. So I'm sorry I don't have a really good answer for you, but I would be a little bit more cautious, just because we know those antifungals can be a little bit hard on the system if misdosed or have some sort of interaction with another drug.
Thank you. And the same applies to human, that azole category, which is, very effective for antifungals. It kind of has toxic effects at a higher level, and theoretically, THC or CBD could inhibit their breakdown and make the same dose end up creating a higher blood level. Okay. So, wow, so many questions are coming through, Stephen. We might have to have you back, but we'll go for a little bit longer here. Here's one. I work in a vet. This is from Tracy. I work in a vet clinic. We're curious to know how to use cannabis products orally, topically, and post-surgically. And I saw some questions about post-surgical use. She says, currently we use NSAIDs and hydromorphone for pain and inflammation. I've read that cannabis can potentially replace these drugs. Since each animal's endocannabinoid system is unique, how do you dose in order to make sure the pain is managed? So let's just broaden that to, a few questions that I would take out of that. Number one, opioid cannabinoid interactions in animals, any different than in people? Should we expect something different? Another question would be acute versus chronic pain, which can be different in humans in terms of their response to cannabis. And then there was a chat question about post-surgical topical use in the area of the incision.
Yes, so those are all really fun questions and right up my alley as a pain guy. So when it comes to topical applications, I'm kind of a purist, and I don't really like a lot of things near the incision if possible. If it is, it really needs to be a medical grade, sterile type product. And, we showed some of the data here with the transdermal study today. Given the product that was made, the pickup may or may not be helpful, might help with some local inflammation. I am, however, very interested and do use cannabinoids for post-operative pain, acute pain. I really prefer the acids, as Dr. Sulak mentioned earlier. They can be cyclooxygenase inhibiting. And if you have that benefit of having some of the decarboxylated forms in there as well, you kind of get this dual effect. You have the acidic forms preventing arachidonic acid, which is starting this inflammatory cascade, and then you have the other benefits of CBD, again helping prevent some of that, but also helping in other areas with our TRPV receptors. So there is a lot of potential for that for postoperative pain. I believe there is a study going on right now at a major vet school, which is exciting. So I'm excited to see those results come out. There's another part to that question.
I think in general, acute versus chronic, was that
Sure.
it?
Yeah, so again, for acute and chronic pain, I think these are a great option. And that's what it was, mixing with other drugs.
Opioids, yeah.
So what we know so far with phytocannabinoids and mixing with non-steroidal anti-inflammatories, common drugs that we use in veterinary medicine, carprofen, meloxicam, robenacoxib, we know that we have safety giving a phytocannabinoid product and those NSAIDs at the same time. When it comes to opioids, we don't have a ton of data on that so far, but it seems to kind of be mirroring what we see in humans, where we can have maybe like a 40%, maybe even higher reduction in the amount of opioids we're using for those patients. We also see that effect with non-steroidal anti-inflammatories as well. It is very, very common when we start a CBD product, in particular for an animal, that we can decrease that non-steroidal anti-inflammatory dose by 25 to even 50%. Gabapentin is a drug that is often used for chronic pain in animals. We know that gabapentin not only potentiates or makes better the effects of opioids, but we know that CBD or phytocannabinoids in general and gabapentin also work synergistically, and we can certainly decrease the dose of gabapentin, which is great because sometimes we have owners complain about behavioral changes when their animal is on gabapentin, short and long term.
Thank you. Pretty similar to what we see in humans.
Imagine that. Mammals are mammals.
Thank you. All right, another live question, Simone?
No, we don't.
Okay, well, let's get back to the spreadsheet, and then while I, we can focus on this, and then we can look back to the chat for others. So this is an interesting question. So my husband was diagnosed with dementia, possibly vascular, but not certain. He's declining quickly. He was put on antipsychotics, which seemed to make more cognitive issues. He was on a 1-to-1 capsule indica before he fell ill. Of course, the VA would not allow him to have it while hospitalized in their system. I was also told it could be pseudo-dementia due to severe depression with psychosis. He is on Cymbalta. Then I was told possible autoimmune encephalitis, still waiting for results on lumbar puncture. I know cannabis helps with anxiety and sleep issues in dementia. We want to wean them off risperidone and onto cannabis. What works well and what delivery method works best? And so, I'd start off with, in my experience, the cause of the dementia is not that important. I've treated patients with a similar dementia presentation that have Alzheimer's, vascular dementia, other types of dementia, and essentially what we're working with are behavioral symptoms. So, sundowning, agitation, anxiety, screaming, sleep disturbance, exit sleeping, that's the primary reason that people will bring their family member with dementia to me. And I haven't really seen that the cause of dementia makes one more or less likely to respond to cannabis. In my experience, in these cases with severe behavioral disturbances, THC is by far more effective than CBD, especially at the doses that my patients can tolerate. And so I'll sometimes use a mix like a 1-to-1 that he was on, or just a straight kind of a THC dominant formula. I have absolutely found that having some of the acidic cannabinoids seems to make the treatment better and more effective than just fully decarboxylated. And so it is safe to use the cannabis in combination with these antipsychotics like risperidone. And so usually what we do is we start cannabis and titrate it up until we see a significant improvement in these behavioral symptoms, and then very slowly reduce the other drug. And so I hope that's a good answer to the question, but it's, as you can tell, it's a population that I'm passionate about. I think the cannabis has so much to offer people with dementia. I wish that they would start coming in before they were really, severe in their symptoms, because I think there's probably some, at least animal studies suggest that we may have some capacity to slow or prevent progression, especially if we start treatment early, because the cannabinoids have these neuroprotective and anti-inflammatory effects that might be very useful in these conditions. And especially for something like vascular dementia, which is just like a repeated hypoxic injury to the brain. We know in animal studies when you cut off the blood supply and the oxygen to nerve tissue or brain, having cannabinoids around really limits that injury. It decreases the size of the injury and speeds the recovery.
I would say that's certainly true for animals as well. We do have doggy and cat and animal dementia forms in general. And yes, when you start to see those behavioral changes, this is a great option for animals as well. We can see some pretty dramatic turnarounds.
Thank you. All right, here's another question that I just picked off the chat. Thank you, Dwayne. How about smoking cannabis? Any veterinary experience with smoking cannabis, whether it's firsthand or secondhand?
So I guess it depends, similar to the COVID guidelines now, what size space you're in with your animal and how close you are to your animal, right? If you're hotboxing your animal and there's a lot of THC floating around, you might see some static ataxia, you might see some intoxication in that animal. By and large, they'll probably sleep that off. So it's probably not something I'd recommend. There are a couple of companies that are looking at inhaler forms, so not necessarily smoke, but inhaler forms. There's a device called AeroCat and AeroDog that fits kind of on the muzzle of animals. interested in creating devices for aerosolized type products, but I wouldn't recommend smoking and blowing in your animal's face. They wouldn't really like that very much.
All right. Well, let me ask you a question, Stephen. I think that this is an answer that I'm only beginning to know when it comes to my human patients. So I'm curious from your perspective. So Healer makes 2 hemp-based products right now. One is CBD dominant that has 6 parts CBD and 1 part CBDA. And the other is as raw as we can get it, totally unheated CBDA. You know, they're all broad spectrum with really high terpene content. And I don't know if you want to comment at all on terpenes in veterinary medicine, but I'm curious, like, if these were the 2 products available to you, how would you decide to choose one over the other? Would there be a starting point, and when would you switch to the other?
You know, I'm biased, so anything with acidic forms or dominant acidic forms, I would probably lean on that, just because I hold to that adage that Dr. Russo said, you know, there's nothing that these acidic forms can't do that the decarboxylated forms can do. So I'm always partial to those acidic forms. But honestly, like I said earlier, we struggle in veterinary medicine to find quality, good products, and certainly high concentration products. I really like higher concentration products because it's a smaller volume that we're having to give an animal that may or may not be compliant. So it is, yeah, it depends on what you can get, but I do have a preference for the acidic forms. And if you can get high concentrations, that would be great.
Okay, so the Healer CBDA, it's just cannabis MCT oil, and it's 50 milligrams per milliliter, high terpenes, and yeah, as raw as we can get it. Any terpene, caveats or clinical pearls?
Yeah, so as I mentioned earlier, high concentrations of humulene can be appetite suppressive. So I try to avoid that in animals where we're concerned about food intake. I am loving products that are high in myrcene, in particular for anxiety and for pain. I think myrcene is particularly interesting because it can be reversed with naloxone, which is the same drug that they use to reverse opioids with, right? So it's working on the same receptor. We know it can also be reversed. The effects of myrcene can be reversed with yohimbine, which is an alpha antagonist drug. So those alpha receptors are responsible for all kinds of things, but also play a role in pain and certainly anxiety as well. So I think myrcene is really, really interesting, and that's a terpene I really like to see in products if I'm using it for something like pain. There's a little bit of evidence with myrcene in GPR 55, so might be useful for seizure disorders as well. And then beta-caryophyllene, or AKA the dietary cannabinoid, is also really interesting. We see a lot of products that are potentially spiked with beta-caryophyllene as well. And we know that beta-caryophyllene has some similar properties to CBD. So I think that's kind of interesting, especially if you can't get a high concentration product or your animal seems to be responding weird to CBD, even though I've never really heard of that. You might want to lean on a product that has higher beta-caryophyllene in there.
Thank you. All right, we're going to wrap up soon, but I think we have a couple more live questions. I also know that we have, I just saw on the chat, Dr. Charles Harris, who has some clinical experience that he might want to share with his patients that have autistic spectrum disorder. And so, yes, Simone, I'll turn it over to you. Who's next?
Sergio's next.
Okay.
Hello, can you hear me?
Yes, Sergio, we can hear you.
Hello, I have 2 questions. One is cancer related and the other is diabetes related. So my father is a survivor of colorectal cancer. He did chemo, radio, and suppositories, cannabis suppositories, and he survived, thanks God. And right now he's feeling better, but I wonder if he could continue the treatment with cannabis oil at low doses of THC and CBD, just to keep the cancer under control, because I know cannabis has immune depressed properties. So I wonder if it is a good option to keep the cancer under control.
Great question. And I think the obvious answer is that we don't know. We have such little evidence on cannabis and cancer, but I will say that if you look at what we call secondary prevention of cancer, so you've had it, it's gone, how do we prevent it from coming back? Typically, the best indicators or the highest associations with various factors in one's life that might prevent that cancer from recurring are the basic things that help all of us stay healthy. So it's sleep, it's exercise, it's good nutrition. And I think that if there's some way to weave cannabis into a person's life that supports them feeling their best, laughing more often, sleeping better, having fun, having social interactions, having less pain and less anxiety and less stress, then that's probably going to be beneficial for secondary prevention of cancer as well. And I think, so we're talking about two things here. There's the direct effects and the indirect effects. I would not worry about cannabis suppressing the anti-cancer aspects of the immune system if used in a low dose. That can potentially happen if he was like really taking these high, anti-cancer doses that people talk about, like the Rick Simpson protocol and so forth. And I wouldn't recommend that for secondary prevention. What I'm curious about the cannabis dosing during his active cancer treatment, was that super high or was that just kind of like a symptomatic low moderate dose?
It was a low moderate dose.
Okay.
Yeah.
So yeah, that would be my advice to you, is see him as a unique person, find out where his challenges are, and feeling as healthy and as engaged in life as possible, sleeping as well as possible, being active, and use cannabis in a way to try to address that. Does that help?
And the second question that I have is regarding me. I'm a diabetic patient, and for a long period of time, I felt that when I build some tolerance consuming cannabis, in other words, like I consume cannabis, after a while, 1 week, 2 weeks, I need to increase the dose to feel the same feelings, all right? When I reach that tolerance level, I feel I need less insulin in my body to control blood glucose. I'm type 1 diabetic patient. I was looking around some papers, and I know that the consumption of low doses of cannabis or cannabis in general reduce the insulin resistance, all right, and change somehow the metabolism of the patient. But I don't know in my case if there is a correlation, scientific correlation, or you in the clinic have experienced decreasing insulin necessities for type 1 diabetic patients when they consume cannabis.
Great question. I love it. So first of all, I have witnessed this many times with appropriately dosed cannabis reducing insulin requirements in type 1 diabetics. And, I could explain that as a direct effect of the cannabis, typically the THC, or is it an indirect effect, again, because there's less cortisol and less blood sugar and maybe better sleep and better eating habits. But your experience is very interesting to me, because I'm not sure if you're aware that there was a CB1 blocking drug called rimonabant that was actually approved as an anti-obesity treatment, but theoretically it's not just about anti-munchies and appetite. Actually, blocking the CB1 receptor can be something that's helpful in people with obesity and in animal models of diabetes and insulin resistance, and hepatic steatosis and many other, kind of associated conditions with that. So that's blocking CB1 receptor. Now, when you build tolerance to THC, you're downregulating your CB1 receptor. So that would be a mechanism of action that's likely similar to rimonabant, but of course, without the negative side effects of that drug, which cause a lot of people to commit suicide. So, a much safer way. What I'm curious about is there a lower non-tolerance building dose that might work for you, especially in conjunction with other, kind of lifestyle modifications? And I'm not sure. You tell me what you think about that lower dosing range where you still feel the THC.
In terms of, I cannot tell you the dosing because I'm doing vaporizing THC dominant strains. And I don't know exactly the dosing, but what I experienced for a long period of time is to control my diabetes pretty well. It's just smoke vaporizing for a long period of time. I build tolerance, and when I reach that level, that I'm not happy because I don't get the stone, but I'm happy because I can control the blood glucose levels pretty well.
Very interesting. Have you had much experience with CBD and insulin requirements?
No, I'm not very sensitive to CBD, unfortunately. I mean, I would like to try the CBDA if I feel anything, but orally, I don't feel anything with CBD. If I vaporized CBD dominant strain, I feel relaxation and all the good feelings from CBD treatment, but not orally.
Got it. An interesting catch-22 that you find yourself in. And you know what I would suggest is, and I know kind of modifying one's insulin regimen can be arduous, but I suspect that there's a rhythm in your life to have sometimes that are THC sensitive and sometimes that are THC tolerant, and that might in some way give you the best of both worlds. You know, I think physiology appreciates fluctuations. That's what it tends to do on its own. And therefore, I think a static treatment that never changes might become limiting over time. Like, for example, once you build tolerance, maybe that would reduce your insulin requirements, but over time, maybe that would stop working. And then you would reset your sensitivity, recover some of these great feelings from the THC, and then head back into tolerance. And maybe there's a cycle like that for you. The other suggestion that I have is when it becomes more available, there may be some benefit to THCV, which, you know, right now the varieties of cannabis that contain it also contain THC, but THCV has the ability to gently block the CB1 receptor and have some I think it was anti-glycemic and weight gain effects in one human study, and not at a high dose. I think it was 5 milligrams twice a day.
Any strain that you suggest with THCV?
You got to look for it. I mean, I don't have access to that here in Maine. I know in California, at least over the last few years, there's been one called Black Beauty, I think. You know, there's no THCV dominant strains that I'm aware of, but there are some that have kind of both. And I'm seeing on the chat now that there's one product out there that has THCV. I don't know if you would want a pure THCV product. You might want one that also contains THC, or you could experiment with them and let us know.
All right. Thank you so much.
You're welcome. Great questions. Thank you. Okay, let's do maybe one more. I actually am going to be attending another webinar at 9 o'clock on COVID and Lyme disease. And so we'll just take one more and then we'll, I'll turn the page.
Mariana's next.
Yeah. Hi. Thank you, Simon. Hi, Dr. Dustin and Dr. Stephen. Well, I'm a GP from Mexico, so I've got this approach to all the cannabis medicine, but it's very interesting that it's very low information down here and very low, very few people that know about this and get into the treatment to the patients. And in the veterinarian area, it's like none. So there's some questions. I think you talk a little bit of arthritis and joint pains in dogs, especially, but I would like to get a little more information about it, like more deeper, because I've seen these a lot of questions. Like a lot of people question me about this, but I'm not like a veterinarian. I can know and be related to the human stuff, but I would like to hear a bit more from you. What can you say?
Yeah, absolutely. So if you didn't hear it earlier, we do have a textbook coming out, and is written by over 30 veterinary specialists in their field with 14 different chapters. In fact, I just have to do a shout out because I saw him in here. Dr. Robert Silver is in the room, and he was my mentor and the guy I kind of modeled myself after. He was the very first veterinarian speaking about cannabis in animals. So it is cool that he's here. There are 7 papers right now out there showing efficacy of CBD products being efficacious in decreasing pain scores in dogs with naturally occurring osteoarthritis. So there are 7 positive studies, and they're all dosing anywhere between that 0.5 milligram to 2.5 to 2.5 mg per kg twice a day dosing. I think the safe place to start with a CBD dominant product, a hemp product, is at that 0.5 mg per kg, and work your way up. Typically, we do see a response within the first few days, if not the same day. And then for any veterinary practitioners that are in this group in particular, we do have an active Facebook group called the Veterinary Cannabinoid Academy, where we do similar things to what Dr. Sulak does, and we post papers and kind of discuss them. It is only for veterinary professionals. We are building it out for pet owners, don't worry. But that is a good place to get some veterinary specific information.
Okay, so that you said is just for veterinarians. It's not just for the healthcare professionals.
It is only for veterinary practitioners.
Right,
Yes.
yeah, because I'm looking for something to get more into the veterinarian stuff. I've seen some little like diplomas or certificates, but nothing very accurate. And I'm in the healing training program of Dr.
great.
He's fantastic. I haven't finished it, but I don't know if they talk a little bit about it after. I'm not sure yet.
About pets? No, I don't include any veterinary info in there.
Yeah, I mean, that would be like interesting because there's a lot of people like getting interested into it, and me as a doctor and getting into my human patients. I get a lot asked of these questions about this matter. So, and related to that, I would like to ask you, like how would you recommend me to do an approach to other healthcare providers as veterinarians or other MD to get into or to kind of accept these treatments? Because I've been like treating with people accepting it, but
Sure.
no, that's not in the. I know it's kind of lack of information, but I know sometimes it's kind of difficult treating with this kind of negative reactions too.
Sure. So something in veterinary medicine that has been pretty successful for me so far is in veterinary medicine, we do have FDA approved drugs, but most of the drugs that we use in veterinary medicine are not FDA approved for that species or that condition. And in the United States, veterinarians can prescribe these drugs, even though they're not FDA approved for that species or condition, per this specific act that we have. It's called MDUCA, irrelevant to you. But what is interesting is when you talk to other practitioners and ask them for.
All right, we are going to go ahead and close out the webinar for tonight, and it was an absolute wonderful discussion. I want to thank you for listening in live. This is Carlos, aka CJ, and don't forget, before we leave, do us a favor, go over to rogue420.net, bookmark that site, because right there at rogue420.net, you're going to get all the information that you need as it relates to everything in the healing industry, whether it's again, whether it's investment, whether it's hemp, cannabis, advocacy related information. It's kind of a one-stop shop for everything that you need for the hemp and cannabis industry. You can also jump over and follow us on Twitter, which is at myrogue420. We do also have a Facebook page that you can follow us on, and that's Rogue420 as well. Just want to thank Dr. Dustin Sulak and also Dr. Stephen for their efforts tonight with their wonderful webinar. We're very fortunate to have Dr. Dustin Sulak in our network. The last time he interviewed, we had a discussion about maybe doing a one every 6 week conversation with him to help promote his work. It's just something that I truly believe in as it relates to everything with education and the healing properties of cannabis. So go over to healer.com, check it out. I want to thank you all for tuning in. Be safe. God bless. And we'll catch you the next time. Take care. Thank you.